Hi everyone, my name is David Gomez, CEO of Infinitusmedical Technologies here at the home office or at the office during the lockdown. Just wanted to make a very brief video to demonstrate how we should manage a patient's airway post-COVID-19 when it comes to positioning your patients for Trendelenburg or any other procedure requiring lithotomy. So to keep this brief, this basketball will represent the patient's head. We always want the patient's head here. That way we can make sure that we have a good mask seal, that way we have time to pre-oxygenate our patients adequately, and when it comes to inducing the patient to get ready to intubate them, we want to minimize any risk of aerosolation in the room by keeping the mask seal until we are ready to intubate, and then doing a laryngoscopy, either do direct visual or a video laryngoscopy, so we can get that tube in as quick as possible to secure that airway again to decrease aerosolizations. How this industry has always done it before COVID-19, and we all thought this was normal, and for us as a company, we never thought it was normal, which is why we created the products that we did. This table right here represents a new surgical table on the market that has a 45-inch midsection minus the headpiece. So if you look at the average human being only has a sitting height, which is the top of the head to the sacrum, of about 34.5 to 36 inches. So if you compare that to a table, say for instance that is 45 inches long, again minus the headpiece, we can see how we would have to either move a patient to facilitate that change in lithotomy after we intubated them up here, or the way this industry seemed to think it was okay before COVID-19, we would pre-position our patients down there because it's very heavy to lift them with a sheet and by hand. We would pre-position those patients down in a lithotomy-ready position, and their airway would be here. As you can tell, if you look at the distance from where I'm at to where the airway is, this is not going to be acceptable anymore in this post-COVID-19 phase, because we want to make sure that A, we have a good mask seal, especially for larger patients who are going to desaturate a lot faster, and B, we want to make sure that we have the ability to do a visual or a video laryngoscopy, and to do that is going to require us to really have the patient here. So we've always had a better system that I'm about to just go ahead and edit in right after this to show you why our systems are completely different than every other system that's currently on the market. Every other system, whether it's a beanbag or whether it's some foam device, they all strap to the distal end of the table for lithotomy if that's where our patients are going to be. And then we've got to figure this part out because we don't want to lift patients up with a sheet. This sheet, on the other hand, because that's what we use to lift and move our patients, is also covering about 40 to 80% of the effective pad to skin contact surface area that you need to hold your patient in place. Once we lift and get them down there, then we have to go through the rigmarole of rolling patients back and forth and then tucking this back underneath the patient to secure the arm. Again, wiping out that effective pad to skin contact. None of our products require any of this, and I'll show you why. Hey everyone, this is the Genesis system. I'm going to explain to you the benefits of the Genesis system over any other foam pad system you happen to be using on the market. We have the only modular pad systems on the market, and what I mean by that is each of our pads have 4 handles on each side that allow staff to lift and move both patient and pad to facilitate positions like lithotomy instead of lifting them by hand and sheet. The benefit of that is that you can always position the pad at the top of the table so we can optimize where that patient's head is, so I can do a good pre-oxygenation. We have a good mask seal so we're not aerosolizing contagion in the room, COVID-19 contagion or any other airborne contagion. And then once we go to sleep and we induce, then I also have the patient here where I need them so I can manipulate the airway as minimally as possible in order to get that tube in so we can start general anesthesia. So again, position the patient at the top of the table, always have a good access to the airway. Once you go to sleep, secure the airway in, then we can start IVs or do whatever we need to do. But when it comes to tucking the arms, no more rolling patients back and forth and using a sheet to tuck back under them to hold the arms in place. We don't even have to roll. All we do is do this technique. You can see this on our website. I don't have anybody here to do this, but that's all you do to tuck the arms. No more rolling patients back and forth. we're done. Then we have access, 100% access to the arms during the procedure in case we need to. Once the arms are secure, staff will come alongside, depending on how big the patient is. They will lift and slide the patient into position here. Once they lift and slide the patient in position here, they'll secure the system down here. And then they'll put a chest pad and a chest strap and secure the patient up at the top of the table. And that is it. So we've optimized everything about how you position your robotic patients and your minimally invasive patients. We've optimized where we place the patient from an airway perspective, so we have direct access to the airway at all times. We've standardized arm adduction processes without rolling a patient back and forth, and we've given you 100% pad to skin contact, so that way you have maximum stability and traction in order to hold these patients in these positions. But that is, in a nutshell, how our systems work, how and why they are better than any other foam pad system on the market. Simply because for us, the airway has always been first, or at least equal with what's desired from an efficacy standpoint as it relates to surgical positioning needed to perform the procedure. Anyway, stay safe out there. If you have any questions, please visit us at infinitusmedical.com. And again, stay safe. Thank you.